Recording.
Hello, I'm Daniel, and this is the Chapter 66 podcast. I am the first vice president of the chapter, and with me is our chapter president, Shannon Ellis.
Hi.
And with us is our super producer, Nikki. Say hi, Nikki.
If I've got to. Hello, everyone.
And today we are going to talk about something we talk about a lot, and that is COVID-related issues. And we're going to talk about several different things, but to start us off, Nikki is going to read some questions from members, and Shannon is going to answer those. So
we're going to
let's
try.
do that.
Do we get to call this Ask Shannon?
Yes.
Yes.
Okay, for Ask Shannon. I know my coworker is here and has COVID. What should I do?
Yeah. If you suspect that your coworker has symptoms or that they do have COVID, please do not take this into your own hands. Take it to a manager. Be discreet. It's not your place to go spread information out to other employees. Just be discreet. Go to the manager. Tell them that you either know that the person is COVID because you've heard them say that, or that they're experiencing symptoms. Again, do not take this into your own hand. Do not address that employee directly. Take it to management. What you have the right to do is, if you feel that you are being exposed to the virus, you can ask to be moved to a safer location. You can ask that your manager temporarily locates you to another area so that you are away from that person until management has the opportunity to address the situation.
Okay, next question is, why won't they shut down the building?
Yeah, good question. Okay, so we know that it costs a lot of money to shut down the building, and we have a ton of work to do. So right now, the management is telling us that as long as they're doing everything that is recommended by CDC, the minimum that's allowed that they have to do with CDC, then our building is safe. And they're following the cleaning guidance, which requires them to clean within 3 days. If a COVID case has been reported, they're evacuating the immediate area when they're cleaning. They are, doing everything that they state that CDC recommends them to do. Now, that doesn't mean that we're happy with what they're doing, but we just don't see them closing the building because there's way too much to do, and the CDC requirements do not recommend that they do that.
Okay, next question is why don't they accept over-the-counter COVID tests?
We've elevated that at least on 2 occasions with management, because CDC guidance does state that over-the-counter tests could be accurate and accepted. Management is telling us that their guidance coming from IRS is that they have to wait for a medical test. They cannot accept the over-the-counter. What we would like to advise employees, that if you can only get an over-the-counter test, because we know how difficult it is right now to get the test, and if that's the only thing that you have available, you go ahead and report it to your manager that you had an over-the-counter test and that you are in the process of getting another one possibly, and report the case, report that positive test. If management refuses to write up the report based on an over-the-counter test, employees have the right to input that SAMC report. We refer to it as a SAMC report. You have the right to report that incident. So we recommend that you do that, and then still follow the procedures to notify your managers that you tested positive.
And if you have no idea how to input a SAMC report, just FYI, every COVID notification email has the link to do that in there. And if you read those, you can find the link and you can input your own SAMC reports. I did it for one employee, not myself, but an employee that had COVID that said, hey, I can't reach my manager. I put in their SAMC report for them, because any employee is allowed to do that.
Right. And still follow your procedures of contacting management so that they know why you're not there and what's going on. But yes, you can input those reports yourself, and we encourage you to do that.
Okay, and as a side question to that, this is one of my own, not a employee-based one. With what you said, that management does not accept that, should they also, when they're telling their manager, this is all I've got for right now, should they include with that statement, I am trying to get a medical done test to back up my home test?
Yes, yes. We recommend that you do that, because if management's not going to accept that, the most important thing is we need to get that information on the floor immediately so that they can start the cleaning process. They can notify the area that's been impacted. They can notify any employees that were directly exposed. So we do recommend that if they're saying they cannot accept the over-the-counter, then let them know that you are in the process of trying to get a medically the medical test.
Okay. And the last question that we have for today is, what type of leave can we use if we're exposed or we have COVID?
Okay, so that's why the podcast that we're doing today is all COVID-19 time and leave options that are available, and it's based on an email that recently come out. So we're going to hopefully answer as many of those questions, of that question within this podcast. So first, we would like to make sure that employees understand what is quarantine and what is isolation. So Daniel's going to help us with that.
So I have printed up a document from the CDC about quarantine. It's called Quarantine and Isolation, and I think we'll include that in the notes on this podcast, but it updated January 9th, so it's still effective, presumably. So first of all, these words, quarantine and isolation. What's a quarantine? What's an isolation, right? You quarantine right from the CDC. I'm just going to read it. If you were exposed, you quarantine and stay away from others when you have been in close contact with someone who has COVID-19. So, if you spend time with someone who's sick and you're not sick yourself, you may be asked to quarantine. Isolate is when you are sick or you have a positive test. That is when you isolate. When you were sick or when you have been infected by the virus, even if you don't have symptoms. So if you're one of those people that takes a test and is positive and you're like, I feel fine, you'd still be isolating. So there's a section here on when you should stay home, and this is very important, I think, for us to be aware of, okay? And again, this is the CDC website, which means it's just not IRWeb. Anyone can go to cdc.gov anytime from anywhere. So that's an important thing to remember. So this is the first. There's if-thens here, and this is the first one. If you were exposed to COVID-19 and you are not up to date on your vaccinations, quarantine for at least 5 days. Stay home and quarantine for at least 5 full days. Wear a well-fitted mask if you have to be around other people in your home. And then after quarantine, watch for symptoms. Symptoms can come up to 10 days after your contact with another person. And if you develop symptoms, of course, isolate immediately and try to get a test. And really, it says take precautions until day 10. Wear a mask anytime you're around others. Avoid travel. Avoid being around people who are high risk. Those are just good things to do. Stay away from large gatherings, of course. So, that, I think it used to say 10 days and it now says 5 days. But this next one is, I think, going to be more interesting and more useful to more people. And that is this. If you were exposed to COVID-19 and you were up to date with your vaccination, or had COVID within 90 days, no quarantine. You do not need to stay home unless you develop symptoms. I think people are not aware of that. So if you spend time with someone that has COVID, and you spend time with someone and then a few days later you find out, I have COVID, you don't have to stay home. You don't have to stay home if you are up to date on your vaccination. It is assumed by the CDC that unless you get symptoms, you're probably not going to infect people with COVID. Watch for symptoms until day 10 and take precautions until day 10. Wear a mask anytime you're around others. We're doing that in our building anyway. I think that's good advice in almost all situations. And get tested. if you can. If you develop symptoms, isolate immediately and get tested and continue to stay home until you have results. So, and still avoid being around high-risk people. So that's the important thing. If you're exposed and you're fully vaccinated, the CDC does not say you have to quarantine. The CDC does not say you have to quarantine. If you were exposed and you're not vaccinated, the CDC says quarantine for 5 days. And that being said, if you get a positive test, regardless of symptoms and vaccination status, if you get a positive test, you should stay home for 5 days. You should stay home for 5 days and wear a mask around other people in your home. Don't assume people in your home are automatically going to get it. You may as well not try to keep them safe. No, wear a mask if you test positive, even in your home. If you don't live alone, that is. So, end isolation after 5 full days if you've been fever-free for 24 hours. That's what it says here. So,
and
if your symptoms are improving. So if you're fever-free for 24 hours and you're still coughing all the time and you still feel really, really bad, well then don't end your isolation, right? You would think this would be common sense. If you still feel sick, don't end your isolation. But I guess they have to spell it out here. And if you were severely ill with COVID-19, you should isolate for at least 10 days and consult your doctor before ending isolation. So if you're severely ill, if it just totally wrecks you, isolate for 10 days and talk to your doctor. So the biggest takeaway, I think, is just quarantine for 5 days. If you're exposed, if you don't get symptoms, quarantine for 5 days if you're not fully vaccinated. And if you are fully vaccinated, if you don't get symptoms, you're not required to quarantine.
Okay, so what we do want to recommend is that CDC guidance changes on a regular basis, and although it is recommendations from CDC, IRS doesn't necessarily have to follow all of those. So we get our guidance. Obviously, it comes down from HCO and other operations that mandate what IRS has to do. But we recommend that you do go out and check these links often, because if management is telling you to come back after 5 days and you're still having symptoms, when you go to CDC guidance, it clarifies that if you're still having symptoms, that you should still continue to quarantine. And there's also very good guidance out there on when the first day starts, first day of symptoms versus, then if you get a positive test. So do that. But what we want to go into now, and this is what's generated the questions as to what type of leave is available for COVID, and it recently come out from the agency. So I want to read to you when the agency is telling you to not come into work. So an email went out to all employees on January 7th at 11:40 a.m. This email states, feeling sick, ? Take these actions. So managers were required to share this with employees that don't have access to email. So if your manager has not shared this with you, or you are in an area that you do not have email, we recommend that you go get it from your manager. And because there's some very important links on here that we'll be discussing today. And because there's so much information, we are not going to be able to go into in depth on all of the leave categories that we're going to discuss. But this is what the email says. It says December through February is peak cold, flu, RSV, and strep throat seasons. Managers, please remind employees of their leave options, and there's a link to go to the leave option table that's available. It says don't come into the office if you're feeling sick, waiting for a COVID test result, or if a member of your household is getting tested for COVID. They don't want you in here if you're doing any of these items. So again, don't come into the office if you're feeling sick, waiting for a COVID test result, or if a member of your household is getting tested for COVID. In these cases, you don't enter the IRS building. Instead, contact your manager immediately by phone, text, or email to alert them to your situation. So very important, do not come into this building, but you do need to contact your manager and let them know. It says, don't come into the office if you or a household member have received a positive COVID result. Contact your manager by phone, text, or email to alert them to your situation and follow CDC quarantine protocol, which is what Daniel just went over. We appreciate your dedication to your coworkers and commitment to get the filing season handled for the nation's taxpayers, but keeping everyone healthy is also a priority. So on this, now it goes through and it lists, some of the symptoms, and then it also lets you know that the flu shots are still available in your health unit. But what we want to focus on is the link on the very first paragraph. It gives you leave options, and there's a PDF link. You can also access this by going to the IR web, and on the right-hand side, there's a section labeled COVID-19. You click on that, and it gives you a ton of information. You're looking for the one labeled either COVID-19 leave options, or on the right-hand side, there's one that says paid leave and attendance. So the main question that we're receiving from employees it would be, what type of leave is available if I'm required to not come into the building because I'm either waiting on a test result or I have tested positive? And of course, we want to we would love to address all of them, but we can't. So I want to touch on the ones that are less common. So we'll just to let you know, the most common ones are, you can use your own annual leave. You can use your own accrued sick leave. You can request leave without pay. But the areas that we want to go into are, you could be entitled to advanced sick leave or advanced annual leave. Now, there are requirements that, in order to be eligible for the advanced sick leave. But the main thing we wanted to make sure you understand is that even probationary employees are entitled to advanced sick leave if they meet the eligibility. So I wanted to just read, when you go to this table, and I'm just going to hold it up, but we're going to post the stuff. But when you go to this COVID leave options, when it tells you what type of leave it is in the left column, you can click on those. So when you go to that site, if you click on that, it brings you to the official guidance on each of those categories. And under advanced sick leave and annual leave for new hire employees during probationary period, normally you're not eligible during at least the first 90 days. But it states that advanced sick leave it is not a right. However, managers should make advanced sick leave available to employees who were exposed or are exhibiting signs of illness due to COVID-19, or whose family members were exposed to and are exhibiting signs of illness due to COVID-19. Now, there are guidelines, that fall in the contract. 240 hours is the max for a full-time employee, and you have to be incapacitated for being able to do your job or taking care of a family member. So we recommend that you go and look at all those requirements, because I can't read all of them because it's just too many, but it's an option. Management doesn't necessarily bring that to your attention, and especially for probationary employees, that advanced sick leave, advanced annual leave is an option.
That's never been available for probationary employees before.
Typically
that we know
not.
of.
Typically
Yeah.
not. Just during this COVID pandemic have they offered it. It's just hidden in this form. It shows that it states that advanced sick leave could be an option for employees, but it doesn't address probationary employees. So we wanted to make sure you understood that probationary employees are still eligible, or could still be eligible based on the guidance put out there.
So if it should happen that your manager tells you to do something that violates this email that came from Lori Mings that says don't come if you're waiting for test results, let us know.
Yes.
Let us know, because that's from Lori Mings. They should not be defying that. We should not want sick people in here. But the one caveat, the one warning I want to make is, from what I can tell, often managers are asking for evidence. So just be aware. It's not just, I've been exposed, I'm waiting for a test. You're going to probably, not necessarily, but probably have to provide some sort of evidence, especially if you're applying for advanced leave or leave without pay. It might be a little bit easier to get the opportunity to use your own leave. I can't say for sure, but just be aware. You may be asked to provide evidence.
Right.
So when you come to us and you say, hey, they're telling me to come in even though I've been exposed, if you come to me, my question's going to be, did you provide a picture of a test result or something? And that's it. So just be aware. They can ask for evidence, and there's a lot of indication that they're going to.
Yeah, remember that generally, if it is, the type of leave is subject to management's discretion, typically that opens the door for them to ask for additional information. So just be prepared for that. So the other area that we wanted to make sure that employees understand that's still available is caregiving leave, excused absence for caregiving. That entitles employees up to 16 hours of excused absence per pay period if they are teleworking employees. So this is eligible for, it used to be 20 hours a pay period, now it's 16. Now, to be eligible for this, and I'm going to read this because I don't want to miss anything on this. The employee is caring for their child if the school or place of care of the child has been closed, if the school of such child requires or makes optional a virtual learning instruction model, or requires or makes optional a hybrid of in-person and virtual learning. The other one is excused absence for caregiving responsibilities apply only when an employee needs to and actually is caring for their child, and the employee is unable to work, including telework, as a result of providing the care. Now, those are the requirements, and we need to make sure that you understand that you need to go to this link, and you need to make sure that you fall into those two categories of being eligible for the caregiving. The other area of eligibility is the employee is caring for a family member with a mental or physical disability, or who has 55 years of age or older and is incapacitated for self-care. So, and there's a little bit more on that. Now, again, you could be required, and in most cases you are required, to provide additional documentation to support this. So be prepared for that. If they ask you for something, if you have questions about it, come see us or contact the office and let us do the research and help you do the research to see if in fact you are required to provide that information. The other thing is employees have to make a sincere effort to work their entire shift. So this grants you up to 16 hours of excused absence per pay period. However, you have to show that you have exhausted any ability to work a flexible schedule to work the entire 8 or 10 hours of your daily tour. So, for example, if I have to be home with my child and we're maybe doing a Zoom class or something from 1 to 3, and my schedule is 8 to 4, then I'm going to have to come in and work from 8 to whatever 1, and then I will take off to do my Zoom class with the child or do whatever I need to do to care for that child, and then at 3 o'clock, I'm going to extend my tour after 4 p.m. to make up for those hours I took off. So you have to make a sincere effort as an employee to work your entire tour of duty, even if you have to expand your day. That's the requirement. If you cannot expand your day, then you need to make sure you're requesting this caregiving leave. Yes.
I do have a question about that, Shannon, because
Okay.
coming from as a submission and processing employee, the areas that I've worked in, like code and edit per se,
Mhm.
our shifts are clearly marked out as 6 to 6
Mhm.
because night shift comes in at 6.
Right,
Well, it's 6 to 5:30 is the max shift for a day shift person,
right.
and 6 to 5:30 for night shift persons. So if we have to extend our tour, do they have to provide us with an adequate space for us to finish our tour? Let's say, back to your example, 8 to 4:30.
Mhm.
I have to leave at 1 to take care of my kid who's in a Zoom class. Do they have to provide us a space to continue our work after we get back when it interferes with night shift?
Right. The requirement is the employee makes a sincere effort to work their entire day. If management cannot provide you the space or the equipment to do that, then you would be eligible under this guidance for the caregiver's leave. So that's the main thing. What we ran into is we had a lot of employees that they were working overtime. So at the end of their shift, they wanted to do the overtime. Well, that showed that they were able to work. It doesn't even have to be equipment availability or space availability. I have the responsibility to feed my family at the end of my tour. So if I go home, if I have that responsibility that I'm caring for the child after my shift ends at 4:30, that shows that I cannot work, expand my day. All of that has to be taken into consideration, and those conversations have to be held between the manager and the employee to make that determination of what really fits your situation. Because we know they're social distancing. We've got, we're trying to keep people from, we want to give enough time to clean desks between shifts, that type of thing. So we know that the social distancing is going to be a big factor in this.
I have something to add.
Okay.
So caregiver leave is for teleworkers. So anything about spacing or desk sharing, none of that applies. And it's okay though. I'm glad you asked that question because actually
You're right.
repeatedly employees are coming to us and they're like, "Can I apply for caregiver leave?" And they also ask, "Why is it teleworkers only?" And I don't know the answer to that.
Well, that actually,
Yeah.
that actually hurts
you're
a lot
right, you're
of.
right, it was.
Majority of the employees here are on-campus
Vast
employees.
majority.
But you still
right.
have the ability for, which would be the next thing we talk about, is the expanded MaxiFlex. So those and that doesn't matter if you're on campus or not. But thank you, Daniel. That was a great catch on that. But yes, the fact that if you're on campus and you run into a situation like that, they have to allow you the ability to flex your schedule. And this is based on workload, based on space. So if management comes back and denies it, come contact us and let us know because we need to work around that. But MaxiFlex allows you the ability to arrange your schedule around your home life and situations that are coming up with COVID-19.
Yeah, and I don't know how many schools are closed right now. Like this was a bigger thing last year, I think. But that being said,
Right.
schools could close again.
Right.
And then we're really going to wish we learned this material if that should happen. And a lot of people need this kind of help. I don't know what I'm going to do if my kid's school closes.
Well, and it's not really just, I know recently hearing from friends who have kids, because me being kidless, I don't know much about school systems, but I know out in the Blue Springs area, when it comes to snow days, they're not even giving them snow
yeah,
days.
that's
They're
over.
teleworking kids
Right.
now.
That's
So
Right. Right. Well, remember this is COVID-19 issue. And here's the other thing that we want to make sure. You need to make sure you're going to these links and checking them often because a lot of these things have expiration dates. So we don't want employees to think just because it's available today that it's going to be available tomorrow. In fact, this one states that as of March 31st, 2022, or into the evacuation, the emergency plans, that could change that, whichever comes first.
Whichever comes first.
So make sure that you are clicking on these links. When a situation comes up, you need to be going out and finding which leave category works for you and your situation. And then, of course, if you request it, come talk to us and let us help you do the research. That's what we're here for. So, but this information is available to you, and it is updated on a regular basis. Okay, so now anything else on that one, the caregivers leave, because the one that you rarely hear. Now, like I said, remember, you still have the right to use any of your accrued leaves. You still have the right to use the leave without pay and possibly this caregiving leave and advanced sick leave or advanced annual, depending on your circumstances. You just have to meet the requirements. Now, the big one I'm just going to be honest with you. We have not heard employees using this very often, and I just don't understand why. And if anybody, just to let you know, if anybody has used this and you have information on how the process went, or if you had any difficulty, we would love to hear from you, because the American Rescue Plan, Title IV, Section 4016, when President Biden issued this executive order and this American Rescue Plan, I'm just going to read some of this, but it tells you that regardless of what proof you have, any employee that has been tested positive for COVID-19 could file a workman's comp claim for that time frame that they're quarantined. So I'm just going to read. Basically, this says a definition of who is eligible is a covered employee. A covered employee is identified as who is an employee under the Section 8101(1) of Title V, United States Code, employed in the federal service at any time during the period beginning on January 27th, 2020 and ending on January 27th, 2023, who is diagnosed with COVID-19 during such period, and who during a covered exposure period prior to such diagnosis carries out duties that require contact with the patients, members of the public, or co-workers, or include a risk of exposure to novel coronavirus. The teleworking exception is the term covered employee does not include any employee otherwise covered by subparagraph A who is exclusively teleworking during a cover exposure period, regardless of whether such employment is full-time or part-time. So if you're 100% out of the building teleworking, you never come into the building and you don't see coworkers, you're not dealing with the general public, that excludes you from this. But any employee that comes in and you're working with coworkers and you're in an environment that you come in contact or you have contracted COVID-19, you could put in a workman comp claim. So that's under, again, you go read this, make sure this stuff applies to you. The American Rescue Plan, Title IV, Section 4016. And we would love to hear from you if you've already, but that is something that is also available. So if I'm an employee and I'm having to use my own leave, or I'm getting leave without pay because I have, every 2 months or so I'm exposed and have contracted COVID, or a member of my family has come down with COVID and I'm having to exhaust all my leave on that, if I get it, I know that I have another option. Now, we're not going to guarantee, because like I said, we haven't done this, so we don't know yet how long the process can take. We don't know many of the questions that are being asked. There's more questions than answers on this right now. But this has been out for a long time, and employees need to know that they have a right to file workman comp claims. And those SAMC reports are become a very important part of filing this workman's comp claim, because they're filing reports, incident reports, by filing that SAMC report. So
I think someone interested in trying to do this would do well to see an attorney. Mm-hmm. I do want to make it very clear, we are not lawyers. We can't really say, oh, you'll be able to get workman's comp for this 10 days that you had to use your own leave. We can't say that. So that is the one thing to add to that, is may need to see a lawyer to really get questions answered.
And not as a sponsor or anything for this, because we don't do sponsors,
Mm-hmm.
but I've had some legal matters recently within the 2021-22 section, and I have found there's a website called Rocket Lawyer, and that is actually a very handy website. So like Daniel said, seeking out legal, I would recommend checking out Rocket Lawyer sorry guys, rocketlawyer.com for legal questionings if you have any sort of legal questionings.
Right. And just remember, we're just letting you know what is out there. We do, again, recommend you go read that information that's provided in that email. If you did not get it and your manager did not share it with you, ask them for it, because those links are key to what's available to employees during if you have COVID or happen to remain out of the building because you're testing for COVID. So again, this probably is going to generate more questions than answers, but if you have any specific situations, we don't recommend that you put it on the Facebook page, because we're not answering all the specific instances or scenarios. Contact the office if something happens, if something's happened to you or you've been denied some type of leave. Contact us. Let us help you do the research and see if we can get you qualified for one of these types. Just remember, you're not in this alone. We're all facing the same thing. And National meets every 2 weeks with National IRS to discuss this evacuation and COVID-related issues. And they're still working on what it's going to look like when we all return to the building. So stay safe. And like I said, if you have any questions, definitely contact us.
I want to make it abundantly clear that calling Shannon or calling Daniel directly is probably not the most effective way to get your issues handled.
No, we're super
A
busy.
lot of people seem to think it is, but no, please call our office, and if nobody answers email, or really just call and email all the time, that's the best way to get in touch with who can help you.
Back to your calling and email, actually it would be recommended you do both scenarios, reference the email that you sent, or in the email reference the phone call you made, because that leaves a paper trail for not only us to help you with, but for yourself. It's your sort of reliable source saying, I did XYZ,
Right.
why isn't XYZ being taken care, or this problem being taken care of? Because I did XYZ steps.
Right, and you need to understand that a lot of times we're very limited on our phone and our message capacity. So a lot of times in the office, once we hit a certain number, those calls you can't leave a message. But also we have employees that you feel rushed. I talk very fast, and so you feel rushed or you speak fast and it's not very clear. Maybe for whatever reason the message doesn't come across clearly. Email does every time. So it is always recommended to email our Chapter 66 mailbox, and that is nteu.chapter.66@irs.gov. The messages are returned much faster in that avenue. And like I said, if we can't make out your name or you forgot to leave a number, there's no way for us to contact you. So as Nikki said, leave both and just reference the other one.
And our office number is 816-499-4496. Please save that in your phone.
Yes.
And I always leave the email, any links that we have talked about today, and our phone number down in the description boxes below on whatever source you are listening on.
Okay. We hope that answered most of your questions.
Yep. Thanks for listening, everybody. And if you have big COVID questions we didn't cover, send us an email and let us know. Maybe we'll do another COVID episode and we'll cover them. We'll see.
I'm pretty sure we will.
I'm pretty sure we will too, unfortunately. So that's it. Have a great day, everybody.
All right. Bye.